We've seen in the numbers that Black and Brown communities are being adversely or disproportionately represented in the disease and unfortunately in deaths.
Although Black, Hispanic, and Native American people are all about 4 times more likely to be hospitalized and nearly 3 times more likely to die of COVID-19 than white people, the CDC reports only 5.4% of Black people have received at least the first vaccine dose, compared to 60% of white people. The reasons, well, they vary. Some cite a long history of distrust with the medical system. Others, a lack of access to health care. But physicians like Dr. Joseph Gobern are working to bridge that gap by partnering with churches and other organizations trusted in underserved areas.
We will come into your community so that we can serve our population in your community so that people trust the situation that they're in to go and get the vaccine. We eliminate those barriers for access to getting the vaccine by going into those communities and doing that.
Even with groups vaccinating thousands of people, like the Black Doctors Consortium and Mainline Health, whom Dr. Gobern is with, there's still those demanding answers before the needle.
Can you tell us, is it safe, or is there a reason that people should be concerned?
All of the studies that are done develop the safety profile of the vaccine, and there was greater than 95%, which is considered remarkable among the use of vaccine. And side effects is, again, one important to determine safety, and the side effects were mostly local, similar to what you would get with the flu vaccine, where you may have some local tenderness, you may have some soreness and body aches. And so that we consider to be an exceptionally safe.
As more strains or mutations of COVID emerge around the world, talks of a second booster shot also has people concerned.
As these variants come out, then they'll tweak the vaccines a little if necessary, if it doesn't appropriately address it, to make sure that that vaccine attacks these new variants, and those would be a purpose for boosters. So either your immunity doesn't last for a long period of time, or you get a new variant that is not appropriately addressed. When you get the vaccine, there's a CDC website called vSafe that you can register. This allows us to report any adverse effects that you're having. You'll get a push notification, usually through your mobile device, and ask, how are you doing? And it's, it'll go several days and see if you're doing well, and may go out to a week or so. And by capturing that data, that we have a much greater pool of people and information that we can share and get information about how the vaccines are working.
Hi, I'm Shirley.
And I'm Regina Mitchell. For more videos like this, subscribe to WHYY.